Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Now I am talking to my students and colleagues and the other who want to appear in the primary examination of the FCPS or USMLE. USMLE Part 1. Although the books are available and people are following basically the MCQs, BCQ pattern, they are just learning the books which consist of many BCQs and slight explanations have been given also in those books. But my way of preparation of the FCPS Part 1 is different. I want 100% completion of the knowledge. I am Professor S. Ali Azhar. I am Senior Visiting Professor of Medicine, JSMU. Although this is not my field, I said that I have made 8 modules of the preparation, and every module has got a different type of the aspects, modular type of preparation. Now, the first module which was I written, it is just for a sample, and because I am not related with the anatomy or physiology as a teacher is concerned, but just for nothing, just for your guidance, I am giving this type of tutorial. This is what is actually called as the general anatomy, basic anatomical terminologies. First of all, although this looks very basic, but you will be astonished that many of us do not know exactly. We don't know the terminologies, exact terminologies which we are using. So that's why this part is for all of us, including me, just for revision purpose. That the anatomical terminology is a form of the scientific terminology used by anatomists, zoologists, health professionals, such as doctors in clinical, clinicians, and pharmacists. An international standard for the anatomical terminology is called the Terminologia Anatomica, has been created on the website also. This is the part, Terminologia Anatomica. It should be followed by all of us because it is a standardized form of the definition has been given. Terminologies of the location. Because you have to explain something. The location should be there to explain it. The anatomy terminology is often chosen to highlight the relative location of the body structures. For instance, an anatomist might describe one band of tissue as inferior to or another to the physician, might describe a tumor as superficial to a deeper body structure in relation with it. One is medial on one side of the body, one of the other, the lateral side of the body. So location, it means that it is the relative terminology. You are using it. The inferior, superior, superficial, deep, these are the terminologies we are using. As far as location is concerned, first of all, this is the position, what is called the anatomical position. Anatomical position is this is the sample which is given, the face anteriorly, the 2 lobes of the ear should be in front and you can see it. This is the right side, the left side, and this is all the part. You see the abdomen and the thorax, and these are the forearms and arms, and the palms are slightly medially rotated. It is in the supination, and on the lower down again is the dorsiflexion and the feet, and it is straight forward. there is a slight distance between the two lower limbs. Literally, you can see like this. This is called anatomical position. That is the posterior part of this is seen in the lateral position, not here. So this is the anatomical position. If one is asked what do you mean by this anatomical position, you should describe all of it. Otherwise, you will miss it. The person cannot understand. The relative terminologies have been used with this. Anatomical position is proximal to distal, superior to inferior, lateral to medial, and this is the superior position, this is inferior position. Interior to exterior, and this is relative comparison. So, but you should use these terminologies in relation with related with the anatomical position. If I said it is liver is anterior in the right upper column, it means that interior means this. There is some structure behind the liver also. It is palpable, that's why it is palpable, and it is interiorly positioned, while the kidneys are posteriorly in position in relation with the other structures. These are the anatomical position and related terminologies. So position is this, that location is based on the body position, what called the standard anatomical position. I have already explained it. Person is standing, feet at a pace and with palms forward and thumbs facing outwards. Just as maps are normally oriented in the north at the top, the standard body map of the anatomical position is that of the body standing upright with the feet at shoulder width and parallel toes forward. The upper limbs are held out to each side, and the palms of the hands face forward. Using the standard anatomical position reduces the confusion. It means that regardless of the position of the body, the position of the structures within it can be described without ambiguity. Medial means medial, lateral means lateral. You said it is lateral to this, medial to this means same to all of the world. Now, anatomical regions. Now, in terms of the anatomy, the body is divided into regions arise. In the front, the trunk is referred to the thorax and abdomen. It is also called torso, trunk or torso. So it is thorax up and down, abdomen. The back as a general area in the dorsum or the dorsal area. And the lower back is the lumbus part of the lumbar area. It means that lumbus plus dorsum create the posterior of the back. The shoulder blades are the scapular area, and the breastbone is the sternal region. In front, it is protruding out. There is sternal angle also. The abdominal area is the region between the chest and the pelvis. The pelvis is included. Region between the chest and the pelvis. And behind the pelvis, the most inferior side of the pelvis is called perineum. The breast is also called the mammary region, the armpit as the axilla, and the axillary or axilla, and the navel. Terminology we use as umbilicus here or umbilical region. The pelvis is the lower torso between the abdomen and the thighs. In terminology, the groin, where the thigh joins the trunk, at the inguinal area. So loin is the area, loin, L-O-I-N, is the area where the back of the lumbar area, lower down, it is in between the lower part of the ribs to the iliac crest. That is called loin. If the loin area means lower region, it means that this is the area which I mentioned just now. Now this is all which is explained here, all of this. Whereas the thorax is concerned, this abdomen, this is the sternum genitalia which is visible, this is the perineal part, hands, the the supination now, the dorsiflexion, the distance between the two limbs, lower limbs, side, and the back, the shoulder blades, interscapular areas. Here it is the groin area here, the lumbus area, with the dorsum area. The back of the thigh means the dorsum plus lumbus. And in this session, all parts are describing. Lower down there is the popliteal area, popliteal fossa, and then we have the other terminologies, the anatomical regions. The entire arm is referred to as the brachium. Entire arm, the brachium is the terminology, and brachial. The front of the elbow is the antecubitus, cubital fossa, front of it, and the antecubital. And the back of the elbow is the olecranon area or region, or olecranal, and the forearm as the antebrachium, anti to the brachium, and the antebrachial, the wrist and the carpus and the carpal area. The hand as a manus, is also known as manus, and manual, because you are doing the manual work. Manual means the work done with the hands. The palm as the palm, and palmer, and the thumb as the pollex, and the fingers are the digits, and phalanges, the outermost part of the phalanges, and the phalangeal. The buttocks are the gluteus area or a gluteal region, and the pubic area is the pubis. Now these are the anatomical terminology as far as region is concerned. The anatomical regions again divide into lower limb, into the thigh, a part of the limb between the hip and the knee, and the leg means leg, which refers only to the area of the limb between the knee and the ankle. The thigh is the femoral area. It is the femur and the femoral region. The kneecap is the patella and the patella, while the back of the knee is the popliteal fossa, or popliteal area. The leg between the knees and the ankle between the knee and the ankle is the crurus. This is the crural part, crural region. And the lateral aspect of the leg, because the medial is very, very thin, it's just nothing, the bone is there. This is known as the peroneal area. And the calf is the sura and the sural region, where the two muscles, gastrocnemius and sura muscle, soleus, is the area. The area where these muscles are there are called the sural region. And the calf muscles are a very important part played in the human physiology also. The ankle is the tarsus, we call tarsus here, ankle, and the tarsal, and the heel is the calcaneus or calcaneal area. At the foot is whole as pes, pes cavis, etc. These are the region why we use pes. And the pedal region and the sole of the foot is the plantar and the plantar. The sole of the foot is a very important part. Very thick structures are seen in the sole. As with the fingers, the toes are also called the digits, like this, digits, phalanges, phalangeal area. The big toe is referred to as a hallux, hallucal, or hallux. Abdominal regions to promote clear communication, for instance, about the location of the patient, abdominal pain or suspicious mass. The abdominal cavity inside it can be divided into either the 9 regions of the 4 quadrants. Now you got, as the quadrant are concerned, the upper quadrant, right upper quadrant, right upper and upper quadrant, right upper quadrant, immediately right, and the left upper quadrant, and the right lower quadrant, and the left lower quadrant. So we divide by these planes. Here is the mid-clavicular line, drawn very completely. It's cutting here is the mid-inguinal line. main covalent point. The two transverse lines here, one is called the transparallelic line, and second one is tubercular line. In this fashion, the 9 regions are formed. Right hypochondrium, epigastric region, left hypochondrium, right lumbar region, umbilical region, left lumbar region, left iliac fossa, hypogastric region, also called pubic region, right iliac region, also known as inguinal region. In this fashion, these terminologies, you know that these terminologies, but I am just revising for you actually. These are the diaphragm, which is dividing the abdominal cavity from the thoracic cavity. Now, quadrants, the abdomen may be divided into 4 quadrants, as I already said about it. Upper, lower, right, left. Now, somebody can ask you what are the contents of this as far as surface anatomy is concerned. Or I will rather more specifically speaking, the regions which I have divided into 9 regions. What are the contents of this? Right hypochondrium, left upper, etc. That is right hypochondrium, left hypochondrium, epigastrium, umbilical region, right lumbar region, left lumbar region, right iliac fossa, left iliac fossa, and the hypogastrium of the pubic area. What are the contents? So when we will study actually the abdomen is concerned, as a gross anatomy, we will divide it. What are the contents? This is general anatomy. They are describing the terminologies, because I don't know how much people know exactly about the transpyloric plane or the transtubercular plane or the subcostal plane, what is the importance of these planes, etc. We will actually, inshallah, discuss, if it is possible, at one time, although it is not my subject. So the more detailed regional approach to divide the cavity into 9 regions, as already mentioned out. There is subcostal line, or it is actually transpyloric line, 9th tip of the 9th costal cartilage. Or lower down it is subcostal line, 10th costal cartilage. So transpyloric plane and subcostal line, very near to each other. Because important is the transpyloric plane. Intertubercular line between the 2 tubercles of the iliac crest, and in this fashion again the epigastrium is the part where the main content was the stomach and some part of the duodenum. In this fashion, the right hypochondrium, the main structure is liver. The left hypochondrium, the main structure, some part of the stomach is there, but the spleen is the main content. Again, in the right lumbar area, the ascending colon, left lumbar area, descending colon, right iliac fossa, main content. The cecum, the appendix, junction, these are the main important part. Left iliac fossa, yes, sigmoid colon. And the pubic area, the urinary bladder and uterus, and these are the structures which are belonging to the hypogastrium of the pubic area. Standardized terminologies are described previously also. What is anterior and posterior? What is superior and inferior? What is the proximal and distal? What is superficial and deep? Interrelated terminologies. What is medial to lateral? The central line of the body, if it is near to it, it is medial. If it is outside it, it is lateral. Radial and ulnar, it is the part which is described in the upper limbs. Radial side, ulnar side. Ventral and dorsum. Because in the animals they use terminologies like ventrum and dorsum. Its ventrum is very equal to the anterior and the dorsum is very equivalent to the posterior, but not exactly. The embryonic actually this is the, and in animals we use these terminologies, but we are maintaining here. Rostral and the caudal, again this is the birds. Rostrum, the big beak, or in the elephant there is a trunk, that is the rostrum. rostrum and the caudal. If it is near to this area, this beak, it is rostrum, it is away, it is called caudal. So rostral and caudal, these are the terminologies used in the central nervous system in relation with this. Very near to the nose, rostral. Away from the nose, away, caudal, for example. And here is again the cranial and the caudal. The cranial part means upper part, and the caudal part in relation with the cranium is the lower down. And occasionally sinister for the left side is called sinister, and dexter to the right are used. Dexter terminology used, Latin terminology for the right side, and sinister for the left side. And the paired organs are there in the body. Adrenal glands, kidneys, they are paired structure, lungs, they are non-paired structures, liver, heart. These are the terminologies you should know. Axis, each location term above can define the direction of the vector. Pairs of them can define axis. And that is the lines of orientation. The person is actually in an audible position. You can do it. For example, blood can be said to flow from the proximal to the distal direction in the arteries, and from the distal to the proximal in veins. And anterior, posterior, medial, lateral, and inferior, superior axes are the lines along which the body extends, like axis of y-axis or z-axis, what is called the Cartesian coordinate system. An axis can be projected to the corresponding plane. One can learn like this. Like the Castelian type of the coordinate system, here is the 0, this is the point of intersection on the right side, the x-axis, on the left side, this negative. Same as the cardiology I have explained, but not y-axis is above and y-axis is below. Y as a cardiology is concerned in relation, it was positive, here it is negative, while y is positive usually above. So it means that this is these are the interrelated terminologies. If the person is, for example, standing here, you can explain whatever you want. It is near to this, away from this, or here, or here, or here, or here. They can be used. They have used. But in the research, this Castelian coordinate system is very important. Anatomical planes to two-dimensional section of the body. Cut it down, a plane. A plane means they are very, usually terminology used in case of the CT scanning. Now this is the part you divide, if it is a saw, cut the body into two from this side, like this. Now this side to this. Now this is the side, you cut it down like this into two pieces. This is the plane. And this plane which is cutting into two sides is sagittal plane. And if it's cut down like this, from here you cut like this. This is transverse plane. And another plane which you used, it is the just oblique on the z-axis. It is called coronal plane. So sagittal plane may be there, it may be a coronal plane, or it may be transverse plane. You can study by intersecting the body, what is on this side, what is on this side, what is above, what is below. It is one way of the study of the CT MRI scanning. Sagittal plane, coronal plane, or transverse plane. Terminology related to the functional status. Anastomosis refers to the connection between the two structures previously branched out, such as blood vessels or leaf veins, and anastomosis. But in relation with the nerves are concerned, they are called plexus, like lumbar plexus or sacral plexus, cervical plexus, and other plexus as well. It is a plexus means the arrangement of the nerve in a net-like fashion. Patency is there in a hollow structure, the artery, the vein. It remains open, it is 20%, 30%, 100%. or 100% patent accuracy, the doctor's accuracy, that is remaining. These are the patents. Patent means this, showing that the patent may also refer to the channels such as blood vessels, section of the bowel collecting system. Every hollow structure has got patency. And like gallstone, kidney and the gallstone, and is occupied by the stone, you say that the patency is gone. 100% of patency is not there. Coronary artery, cerebral artery, the patency is gone to 20%, 30%, etc., etc. Now these are the terminologies that the patency is concerned. Variation. Variation means that refer to a difference in the anatomical structure that is not regarded as disorder. It is a normal one. Many structures may be slightly between people. For example, the heart may lie on the left side. You know that about it. It is called the levocardia. But as a variation, it can be in the center. That is mesocardia. But on the other side, slightly toward the right side, it is called dextrocardia. It is anatomical variation basically. So these are the variations. For example, some tendon which was described on the anatomical position, and that it is inferior and medial. Now you are describing it is superior and lateral. This is a variation. So the example is given as the absence of the palmaris longus tendon. It is not present at that time, but other supportive muscles are there. An anatomical variation is unlike congenital anomalies, which are described, which are considered a disorder. It is not a disorder. It is only a variation. Variations are many examples have been given. Diurnal variations, for example, from the day to the night, the variation in the blood pressure and pulse and other things. Anomalies mean a fixed type of a problem related with the maldevelopment actually in the fetus. It is called congenital anomalies. Anatomical terminology is related to the motion, joints, especially synovial joints. Now synovial joints, you know that the full movement is there, contraction and relaxation of the muscles, either side of the articulation. Synovial joint means it is 100% on the 360-degree angle they can move. Movement types are generally paired, one being the opposite of the every movement. Flexion to the extension, abduction to the reduction, then this especially eversion with the inversion, for example. These are the movements on the joints, they are always paired. So these are the terminologies which are specified in this diagram. The movements, extension, flexion, etc., etc. The general motion, flexion, extension, that is refer to the movement that decrease flexion or decrease extension at the angle between the body parts. What is written in your books is this, flexion and extension. Abduction refer to the motion that pulls the structure away from the abduction, central part. If it is near to the centrum, it is abduction. And internal rotation or medial rotation is the same one. And external rotation means lateral rotation, is the same one. Or away from the external center of the body, for example, in the lotus position. You see in the yoga, requires the legs to be externally rotated. That is called lotus position. And some terminology using an elevation, for example, of the shoulders, depression of the shoulder. And these terminologies can be used in the scapula, in the shoulder blades, and mandible also. Elevation and depression of the activity of the mandible. Best definition of the flexion written in the Greek anatomy, 35th, 36th, 37th edition. That all positions which are required in the uterus, in the second to last trimester, all positions. Look, the head is down, is flexion. All limbs are in the position like this. It is all flexions. Look, the hands, they are also rotating, and they are moving towards the towards the baby. These are flexions. Look, this is dorsal flexion. When dorsum is near to the ankle, and all of the back is also, curved. These all positions are in the flexion. This is the best definition of flexion. Increase or decrease in the angle of flexion extension, although they are definition, of course, but the best definition of flexion is according to the Gray's anatomy. It is the mother of anatomy actually. They said that the best definition is that it all position required in the uterus is all flexions. And they say this is what is pronation and supination and dorsiflexion and the plantar flexion, inversion to the eversion, and the retraction of the mandible to the protection of the mandible outside and inside, elevation of the mandible and the depression of the mandible, the specific position and movements of the hands, a position, flexion, etc., and all other things. A position means one point of the finger is touching to the other point of the finger. Abduction is there, reduction is there, flexion is there, extension is there, and position is there. These are the movements of the hands. One should elaborate special motions of the hands and the feet. These are explained just now. What are they? Muscles are concerned, you know what is insertion, what is origin. This is the interrelated terminologies, where it starts and it ends at the tendon. On the bone, there is a specific mark on it. So, in the forearm and in the lower arm, lower limbs, a lot of muscles are there. They always ask what is the origin, what is the insertion, what is the nerve supply, etc., etc. Now, these terminologies, origin and insertion, should be very clear. There are respective terminologies. And this is not only to be able to revert the action of the muscle, but also brings on the stability of the action through the muscle co-activation. So one is origin and insertion, one point is contracting, other point is at the static. Otherwise, the muscle cannot act. The biceps brachii flex the lower arm, the brachiolateral is the forearm will flex it, and the callus located deep to the biceps with the upper arm. Both they are synergists. Actually, they are aid in this motion of the flexion. So they are muscles which are called the agonists and antagonists muscles, just opposite to it. Agonists are dependent on another help from the other muscles deep, which are called synergists. So, synergist muscles, agonist muscle, antagonist. The prime movers are agonists of the motion. Membranes are there. Every cavity of the body, remember, should be covered by a serous membrane. Otherwise, it is not a cavity. And its cavity, if there is a cavity, for example, the abdomen and the thorax or the brain or the synovium, etc., etc., it should be lined by a serous membrane or heart. So it has got two parts. One is very near to the viscera, which is called the visceral. Another is outside it, it is parietal. And the space between the two is called cavity of the serous membrane, serous cavity. So these are the membranes. The membrane, a good example is given in the balloon. If you put hardly into the balloon, you will find this thing. In the balloon, there is space here. One is very near to this hand. This is the visceral part, and this is the parietal part outside, just like in the pericardium. Very good example is shown in this diagram. So thanks for the listening. Actually, although I am not an anatomist, I have tried to mention some of the terminologies which we are using in anatomy. Thankful, I am very thankful you have listened it. I don't know I am successful in delivering this type of a thing, or a lecture, or a tutorial, or I don't know. What is your feedback, who have listened it? Saima, Sabah, and the Shayan and other people, if they have listened to this tutorial, how much it is beneficial. Give me 100 marks to the 70, 60. Out of 100, how will you figure it out? Assalamu alaikum wa rahmatullahi wa barakatuh.